Hello, everyone, and welcome to another episode of Chats with Your Advocate, where health literacy meets real life. I'm Tiffany James, family nurse practitioner, board certified patient advocate, and owner of Divine Wellness Partners. Tonight, we're talking about a condition that affects millions of people, but is often misunderstood: diabetes, and it's Diabetes Awareness Month. So, whether you're living with diabetes, concerned about your risk, or supporting a loved one, this conversation is for you, okay? And just always, we go through a quick disclaimer. Everything shared in this video is for educational and health literacy purposes only. It is never going to be a substitute for medical advice. So always talk to your care team about your personal needs and your questions regarding your care. Now, let's get into it. So, what is diabetes? Let's break it down. So, diabetes happens when your body has trouble using insulin. Insulin is the hormone that helps sugar into your cells. So when sugar stays in the bloodstream instead of getting into the cells, your blood sugar goes up. And over time, that can damage the heart, the kidneys, eyes, nerves, skin, and more. Okay. So there's different types of diabetes. For simplicity purposes, I'm just going to do a few. So type 1 is an autoimmune condition, okay, type 1 diabetes. So in this, the immune system mistakenly destroys beta cells in the pancreas, and that's what makes insulin. So once enough beta cells are gone, the pancreas can't make insulin at all or very little, and this is why people with type 1 diabetes need insulin to live. So type 1 can be diagnosed at any age, so not just children. Okay, early testing, education, and close follow-up can prevent serious complications like diabetic ketoacidosis, also known as DKA. Okay, some symptoms of type 1 diabetes. So urinating often, feeling very thirsty or feeling very hungry, extreme fatigue, blurred vision, slow healing, cuts or bruises, and weight loss even with increased eating. So as far as screening, if you have a family history of type 1, have your provider check your autoantibodies, okay? A positive test doesn't mean that you have type 1, but it means there's some follow-up and education that may be needed. But again, speak to them about your concerns. They are the partner in your health journey, okay? So ask those questions, make your list. Now, type 2 diabetes is insulin resistance. So this happens when the body doesn't use insulin properly, which is why we call it insulin resistance. So at first, the pancreas makes a little extra insulin, but over time, as the sugars stay high, pancreas can't keep up with the demand. So type 2 diabetes is the most common type, and unfortunately, we're seeing that diagnosis made in younger and younger people, okay? Symptoms of type 2 can be mild compared to type 1, but still there. So urinating often, increased thirst, increased hunger, fatigue, blurred vision, slow healing wounds, tingling or numbness in the feet. Now, just to clarify something, type 1 and type 2 diabetes can look very similar at first, especially in diagnosis with adults, okay? So if your treatment plan isn't working, some things that providers may order, again, are those autoantibodies or C-peptide levels. Talk to your care team, make that list and ask those questions, okay? Another type is gestational diabetes, which occurs during pregnancy because of hormone changes. Many women don't have symptoms, which is why they do the screening during pregnancy. One key point to mention, though, is that gestational diabetes definitely increases your risk of developing type 2 diabetes for both baby and mom, okay? So just keep that in mind. Again, reiterating those symptoms: frequent urination, thirst, increased hunger, fatigue, slow healing, weight loss. And for type 2 especially, that tingling, numbness in the hands and feet, we call that neuropathy. Early detection protects your health long term. So just listening to your body, asking those questions. So why do we want to detect it early? Let's talk about diabetes complications. Early care is very important because if not, diabetes can lead to serious complications if those sugars are staying high. But again, if we can get in there and get things done early, you reduce the risk of that. So some major complications of diabetes: heart disease, chronic kidney disease, dialysis, right? eye disease and vision loss, neuropathy, that's the nerve damage, foot problems, ulcers, skin conditions, gum disease, hearing loss, stroke. And the goal, again, is not to cause fear here. It's for you pushing for prevention and empowerment. So there's a list of things that it can cause, but let's talk about how we can prevent and treat. Healthy eating doesn't have to be complicated. The American Diabetes Association really focuses on the diabetic plate method. So that's your lean proteins, your quality carbs, okay? Less added sugar, healthy fat, fewer processed foods, more water and 0-calorie beverages. So there's a lot of diet plans out and healthy eating options, but for purposes of this discussion, talking about the plate method and that it prioritizes that protein and then the vegetables and those quality carbohydrates, okay? There'll be references in the chat for you to see that, okay? And so something else you can do is physical activity. You can start today. Movement makes the cells more sensitive to insulin, so it lowers your insulin resistance, okay? You don't need a gym. You don't need to do a big thing. Just light walking, stretching, home workouts, dancing, chair exercises, doing a walk with your friend or your animal. Just start, small changes, even a 10 to 15 pound weight loss can improve impact on your changes as far as weight loss and just the insulin sensitivity. So really focusing on that. And again, millions of Americans live with diabetes. Your treatment plan should be personal. And even if you're pre-diabetic, so meaning you're not, that A1C, which is something they check and monitor, is not quite at that 6.5 and higher, you can still make these changes. So if something tonight brought you clarity or help you understand diabetes, please subscribe, share, rewatch this information. As always, our chats are not the full resource on any topic we talk about. It is the beginning of a discussion. I want you to look at the description of the YouTube video, start to expand on your knowledge, start your journey, make your notes, talk to your care team, okay? And again, thank you for joining us on another chat with your advocate. I'm Tiffany James. Subscribe, follow us. There'll be more to come. And remember, confidence and empowerment in your healthcare journey makes all the difference in the world. I'll see you in the next chat.